Alberta Health Services is one of the best funded in Canada, yet has what many believe are mediocre results. From the public side, Albertans deal with long wait times and perceived inefficiencies. Administrators deal with staffing shortages and an unsatisfied public. But is there a win-win solution for Albertans and their healthcare provider? Well, to discuss this in further detail, we are pleased to have Stephen Lewis, a health policy and research consultant and adjunct professor of health policy at Simon Fraser University. Stephen, welcome to Bridge City News. Great to have you on.
Thanks for having me.
Absolutely. So there is so much conversation and opinion in Alberta right now about healthcare. Most recently, I guess our new Premier, Danielle Smith, has canceled a health agreement with the World Economic Forum, saying that she doesn't want to have any ties with a group that brags about controlling governments and politicians. But if the agreement were to go through, the province would supposedly share ideas with health researchers at Mayo Clinic and Harvard University. So, Stephen, do you have an opinion on this? Is she making a good decision by keeping things more Alberta-centric, so to speak, or is she going about this the wrong way?
Well, I think she's gotten out of the gate with some pretty provocative statements. And I think the World Economic Forum thing, which is information sharing, is basically a distraction. It's a red herring. Health systems learn from each other around the world every day from multiple sources, from medical literature, from colleagues around the world. So I don't think it's central one way or the other whether they cancel this, because the same kind of people who would also be part of that forum, they can talk to them anytime they want, 1,000 times a day. So yeah, I don't think that's it. I think more centrally is her stated plans to fire the AHS board, appoint a commissioner. She's blamed the board publicly for almost a conspiracy to understate the staff shortages and so on. I mean, if you want the health system to improve, it seems to be reasonable to have good working relationships and have a trusting relationship with your by far biggest supplier of healthcare, which is AHS. So I think the previous premier at the beginning of his tenure also kind of declared war on doctors a little bit, and paid a pretty steep price for that in terms of trust and ability to get things done. So I don't see any early signs that she's intending to repair that anytime soon.
Mm-hmm. So in your opinion, not exactly the best place for her to be starting with firing the AHS board.
Well, I think to say if we get a new board or we replace it with a commissioner and a one-person commissioner at the beginning, that's going to solve all the problems in healthcare or even begin to solve them is illusory. I mean, Alberta has problems. So does every province. Every province had them before the pandemic, but they are now made much worse by the pandemic. So every province has an enormous surgical backlog. Every province is struggling with primary care and getting it right, which everyone has aspired to for decades but hasn't managed to achieve. I think there is an appetite for change, and there's a need for change because with the pandemic and with all these unmet needs, we can't just wait this out. The system has to be more agile. It has to figure out ways to create surge capacity when you need it. It also doesn't help if you have a government that seems not to believe much in public health anymore, and certainly a premier who has said some pretty dramatically radical things about what you can and can't do to control pandemics and so on. So you have a bit of a perfect storm here, and I think while Alberta is not unique in its problems, it may be unique in the potential for conflict and chaos in the next couple of years, unless the tune changes quite a bit.
Mm-hmm. And of course, some in positions of authority say that the current public health care situation comes down to scarcity of services and funding. And of course, scarcity in economics refers to when the demand for a resource is greater than the supply of that resource, as resources are limited. So in your opinion, do you think the scarcity argument is appropriate, or is there another way to look at healthcare delivery and outcomes?
Well, I mean, we've had a history of this, right? I mean, we have tried to buy our way out and increase supply our way out of health problems historically. From about 1997 to 2010, the country doubled its healthcare spending. And did it get rid of wait lists? No. Did it make sure that everybody had a family doctor? No. So, and then you look on the other side of the ledger, there's a lot of research in health that shows somewhere between 15 and 30% of healthcare is either no value added, and some of it's even harmful, like excess prescribing of drugs to the elderly, which results in a whole lot of people ending up in hospital due to over medication and so forth. So it's not always a supply problem, but the reality is right now, we are not meeting needs. So either we have to use the personnel and the resources we have differently, make a real concerted effort to get rid of the low value care so we can concentrate on the higher value care and get better at the things we've never been particularly good at, which is prevention. So if you have a fairly weak or incomplete primary care system, if you have 600,000 or 700,000 Albertans without a regular source of care, a whole lot of people will end up in the hospital because their conditions got worse when they didn't have to. It's a complicated problem, and you won't solve it in a week and you won't solve it in 2 years, but you do have to chart a new course that gives you some shot at solving it in the long run. I don't believe the solution is just to dump more money into this system, because if you dump more money into the same system, you're going to get the same results. I mean, we have way more doctors than we ever have before per capita in this country, way more than we did 20 years ago, and still there's an access problem. So simple numerical problems and simple saying, oh, if we only could spend another couple of $1 billion, we will solve this. It didn't happen before, and it's not going to happen now.
So from your research, do you think that that's probably the best way that Alberta Health Services can provide better levels of service with a smaller budget, or what would be your opinion?
I don't think you should be cutting spending at this point. And one of the reasons why Alberta spends so much is not because it has more service, it's because it pays better. I mean, Alberta has historically been a rich province, and wages and salaries are higher there. So it's going to cost you more per unit, and that's why the per capita costs in Alberta are so high. I don't think there is any hard evidence to suggest that Alberta is notably more inefficient once you account for that than any other province. And it's really hard to have a blanket overall grade for a healthcare system. I'm not saying there aren't serious problems in Alberta, but those problems aren't unique to Alberta. And Alberta has a lot of strengths. I mean, you have very, very good clinicians, especially the academic centers, and the relationships with their zones and with the province in general is pretty strong. You have strategic clinical networks that try to improve the quality of care. So there's a lot of talent and a lot of infrastructure here. But there's also a lot of rural infrastructure here, and there's a lot of promises being made that, you can't touch anything in rural healthcare. Well, some rural healthcare is by definition more expensive because you don't have economies of scale. And if people say, we voted for you so we wouldn't have to go to the next town to go to a hospital, or we want you to try to recruit specialists to our small area, those are kind of very difficult things to do, and they're costly things to do. But that's a political decision. It has nothing to do with AHS. I mean, AHS is constrained in how much it can move around resources. If AHS said, all things considered, we can meet the needs in this region with 2 hospitals instead of 4, there's no way they're going to be allowed to do that. So don't point the finger at AHS as being the source of this kind of inefficiency. It's built into the political dynamic of the province.
Where do you think the problem started? How far back do you think it went?
Well, the problems, again, aren't unique in Alberta. I think they've started because we've never really had the kind of unified approach between medical associations and governments about how are we going to fix these things together? What do we agree that we all ought to do together? I think one of Alberta's historical problems in a way has been that it's been so rich. I mean, in all those years where Alberta had enormous resources, it built a lot of infrastructure. And again, it was easier to add more money and to buy more equipment and open up another fancy 75-bed hospital in a smaller center than to actually get down to the work of saying, look, let's try to get the waste out of the system. Let's really focus on primary care. And on that score, remember, AHS is not responsible for primary care. So the talk about Alberta having a unified healthcare system that's all one big family doing everything, actually leaving primary care out of AHS, makes it a lot harder to integrate primary care with the rest of the system and operate it like it is a system instead of a bunch of autonomous physicians, thousands of them making their own decisions about where to practice, whether they're going to take new patients, and so on. Now you have the primary care networks that were supposed to do some of this, but it's pretty lightly organized compared to the rest of the system. So again, I'm sorry to make these answers too complicated, but the system is complicated. And there are multiple causes. And if you don't address all of the pieces of the puzzle, you're going to have a tough time making any kind of durable improvements.
Oh, okay, so Stephen, we've heard that the Arrive Can app costs Canadians $55 million. So the reason I mention this is because it was reported to us by an Alberta doctor that the healthcare software purchased by AHS allegedly cost over $1 billion. Have you looked into this software in your policy work at all?
Well, every IT project in every industry, including healthcare, always ends up costing way more than you thought at the beginning. It just seems to be kind of a built-in virus to this whole enterprise. And some of it sounds absurd for sure, but some of it that sounds crazy, you realize, well, they start out and they think they're going to get this, and then you say, well, we have three other things you want to add in here, and then we want to expand it here. I'm not saying that there's great value for money in this. I don't know. I'm not an IT expert, but I think what the system needs is, okay, if I were in charge of procuring IT for healthcare, the first people I would hire are people who used to work in that industry and know it inside out from the costing and so forth, and say, you tell us whether we're paying too much for this. But the reality is, every system in the world, every healthcare system in the world pays a lot of money. It seems to be a crazy amount of money to get the IT. It's just the cost of doing business. And if you don't do it, if you don't create an integrated health record, if you don't have the flow of information, you get all sorts of redundant testing and people still using fax machines and people not having a single health record so that if you're from Grand Prairie and you get sick in Calgary, they know what your record is. It sounds, we all think, why is it so expensive? The reality is it just is. And do it well, and learn from your mistakes in the past, but there's no free lunch here, alas.
Right. Just one of those unfortunate facts of life, I guess.
That's right.
Really quickly, you've been sort of championing Alberta Health Services and sticking up for them. What would your advice be to Danielle Smith for her next step with Alberta Healthcare?
Well, to be bluntly honest, I was agnostic from the beginning about Alberta Health Services. I didn't see any reason why you should get rid of regions in Alberta. But now you have Alberta Health Services. And what we do know is restructuring one way or another, regionalizing, deregionalizing, that none of that solves your problem. Your problem isn't primarily structure. Any structure can work and any structure can fail. So you have this, it's well developed, people know what it is. It's had, 12 years, 13 years to find its feet, to figure things out, to figure out its relationship with the zones. My advice would be, don't mess with the structure that you have. It's not worth it, and it will not solve your problems. It will take 3 to 5 years to adjust to a new structure. The second thing I would say is you have to establish relationships of trust. If everybody in Alberta Health Services, especially at senior levels, is on pins and needles because you never know what's coming next, and is the government going to swoop in and abort some plan that you've been working on for 3 years that has a potential to do good? It's kind of stay in your lane. You have a right as a government to set policy. You have a right to act on your values. You have a right to set broad priorities, but let Alberta Health Services do its job. Sure, hold it accountable, but make that accountability transparent. You better say to Alberta Health Services, this is what we mean by performance. This is what we're going to judge you on. And then if it falls short, you've got two approaches. One is we're going to behead people and we're going to fire them, the lot of you, and we're going to do this and that and micromanage it. Or the other one is let's do quality improvement, learn from our mistakes, figure out how to get better, have constant discussions, and we'll get through this together. You're either a unified province where the government, the Minister of Health, the Department of Health, and Alberta Health Services are colleagues, and they work on this together, and it's not us and them, or they're not. And it seems to me the only way forward here that's going to work is if it is a much more trusting, respectful, and a relationship with good communication between people, and that the last thing you should be doing is yanking AHS here and there, firing the board, figuring, we'll get a new CEO and that'll fix everything. That's just pie in the sky.
Stephen, we are out of time, but we sure do appreciate your insights and conversation. Thanks for joining us today.
My pleasure.
Absolutely. That was Stephen Lewis, a health policy and research consultant and adjunct professor for health policy at Simon Fraser University. Mr. Lewis joined us from his office in Vancouver today. I'm Jeanette Roche on behalf of all of us here at Bridge City News. Thanks for watching.